Now I'd like to open the afternoon round-table discussion themes. The topic is the low-dose radiation exposure and tasks for public health. This session is facilitated by Dr. Keith Weberstock with the co-chair of Dr. Susumu Shimazono from Sonia University. He is also the Professor Emeritus of the Tokyo University. Now, floor is yours.
I would just like to say that the program which we have for this discussion is slightly changed. We will move the thyroid cancer item to the second session today, and we will move the psychosocial effects to after the 100 millisievert issue. And probably we don't need now to spend so much time on the cancer registry. We may not even get there. So I would like now to ask Dr. Kasuga to make her statement, please. Thank you.
Thank you very much. I made a small remarks in the morning session, but again, I'm Kasuga. Nice to meet you. Based on the wonderful presentations in the morning, we are going to focus on several topics in the form of a round-table discussion. But before the opening of the round-table discussion, I do hope that my talk will instigate your thoughts and ideas in the following discussions. In March, there's a report from the MHW research, and this is the gist of the report issued in March this year. As you see here, this is analysis of the current situation of Japan's Food Safety Administration and the epidemiological study on the occurrence of thyroid cancer in the prefecture of Fukushima. And the government subsidy has been used for this study. As a whole, members is headed by Dr. Kenji Shibuya, professor of the Graduate School of Medicine, University of Tokyo. And as you see here on the screen, there are Dr. Shoji Miyagawa and myself served as the research partakers. In addition to that, Dr. Tsuda, who is here today, together with Dr. Yoko Kumagai and Shoichiro Tsugane are the research collaborators. The title of this research is the analysis of the current situation of Japan's Food Safety Administration. However, in the planning phase of these researchers, the researchers have focused on this topic, and especially this reports on the epidemiological study on the occurrence of thyroid cancer in the prefecture of Fukushima, as you see in the subtitle, including other reports. Everything has been disclosed, including this main report. And therefore, please go to the MHLW website. You can download the report itself if you are interested in. Now, the research abstract. Usually, because MHLW is the government of Japan's agency, therefore, the Japanese presides over the English, and therefore there is no official English translation. However, thanks to the collaboration, I can prepare the English version. However, one of the researchers, Dr. Shibuya, has not reviewed this. Therefore, please take this English translation as tentative, casual translation. Now, research abstract. Before reading it out loud, As to the objectives and methodologies, I'd like to give you further details. First of all, objective of this study was the subsidies for the scientific research as a whole research group. Foodborne diseases has the WHO epidemiological study, or FARG in short. For example, foodborne diseases that are reflected to the statistics, but not only those figures, actual damages, the lost hours due to the diseases. These factors are considered to identify the real negative damage incurred to the general public. That is estimated in this project of WHO, and as the government of Japan, we have collaborated in this, and that is the main purpose of this research group. And then, foodborne diseases cannot be ignored. In the accident of Fukushima, NPP, and the Food Safety Administration or system has been examined, and that is the main subject of this research group. In last year, especially the incidence rate of the thyroid cancer should be examined epidemiologically, and that is the main focus of this research group last year. Specifically speaking, on the 12th of March afternoon this year, at the office of Dr. Shibuya of the Tokyo University, Dr. Tsuda, as well as the Dr. Tsugane at the center or head of the director of the Cancer Prevention and Screening Research Center, National Cancer Research Center. In addition to that, the postdoctoral student back then, Dr. Kumagai, attended. In total, 5 members, including myself, shared the data based on each one of research, especially Drs. Tsugane, Tsuda shared their results, and now we had a candid exchange of opinions, and then we confirmed the wording and the languages of this report, and after the review, we've agreed to disclose this. Now, research abstract, as it is the subject or the purpose of this study group, and in order to help the citizens of Fukushima Prefecture and other Japanese people to better understand this disease, we conducted an epidemiological examination in respect of the occurrence of thyroid cancer that may be related not only to external exposure but also to internal exposure to radiation through intake of food and other substances. As a result, in spite of the increase in the number of diagnoses of thyroid cancer, we consider that there is a high possibility of overdiagnosis, and that at that moment it is too early to examine the causal relationship between the thyroid cancer and radiation exposure. Nevertheless, it is also difficult to clearly imply that there is no causality. It was concluded that in order to understand the impact of radiation exposure, alternative measures other than thyroid screening, such as cancer registration, should also be studied, and that it was necessary to examine the effect of low-dose radiation exposure over a long period of time. It was extracted, among others, that in conducting the screening of thyroid cancer, there was a need to show the occurrence prediction simulation based on the progress of the occurrence factors. That for Fukushima and the surrounding prefectures, it was necessary to follow up the screenings by promoting cancer registration in combination with the issuing of a prefectural citizen pocketbook to each inhabitant exposed to radiation, a pocketbook method after the pocketbook atomic bomb survivors sharing medical follow-ups, that there was a need to create guidelines for thyroid cancer screening in relation to the Fukushima Daiichi nuclear power plant accident, that there was also a need to perform an accurate evaluation of external exposure of each region based on WHO reports, and the authorities that with regard to accident cleanup workers, it was important to continue the radiation health management handbook. and that it was necessary to fully discuss with the local residents to the impact the Fukushima Daiichi NPP accident. That's all.
Dr. Kusiga. Before we move on, are there any questions to Professor Suda?
一応補足ですけども、私
Additional information.
されたのは
What I was allowed to check is that the only my remarks that no, and therefore as to this abstract, I didn't take a look at it and I didn't make any review and check, and therefore, especially in the first half, what this abstract says is totally different from what I thought, and however, it seems like a conclusion or consensus of all of the researchers. May I? It's not about your remarks. However, I have sent the whole body of the reports to you, but then I believe you have given us a consent, and based on that consent, together with Dr. Shibuya, I prepared for the abstract. Therefore, it's not only about your remark for confirmation. The whole report is the subject of comment of yours. However, if you look at the first half, yes, it's true that I and Dr. Shibuya alone have extracted the gist as the abstract. However, the Dr. Tsuda said, what you said in the first half is different from what I say. So can you please take a look at the abstract? The problem is that if the person sees only the abstract, this seems like my opinion. I don't want to fight against you. However, I didn't touch upon anything in the abstract. That's what I want to say. And I was not asked to give the consent. That's why in the first half of this abstract tells the opposite to what I believe. And actually, I'm not persuaded with the second half of this abstract.
As a result, after the statement regarding the increase of the incidence of thyroid cancer and your statement regarding overdiagnosis, what I said was that there may be overdiagnosis, but then this is only a part of the entire cases. And so in that sense, I do not think that it is too early to examine the causal relationship between thyroid cancer and radiation exposure, because I think now we have it's already the time to examine this causal relationship. Well, if you did not look at the abstract, it's my responsibility, so I'd like to apologize that I didn't ask your confirmation of the content of the abstract. And also, you haven't given any effective reasoning or counter debate as to my question earlier. And also, regarding what you had just said, I felt in many cases and many situations during your statement that you were lacking certain data, but I didn't have the opportunity or the time to ask you about these questions. So, in a way, during the time of the debates and general discussion, we were the whole of the discussion time was utilized just answering to Mr. Shibuya, Dr. Shibuya, and so there was no other opportunity to ask other questions. That's not my understanding. That's not my memory and recollection of what has happened. Regarding the debate for Tsuchigane Sensei, Professor Tsugane, well, it wasn't the case at all that I was trying to avoid questions for Dr. Tsugane. Well, it may be that I did not ask that particular question to Dr. Tsugane, but then you should look at the minutes. Well, there was no statement or questions to Dr. Tsugane. Well, there were many questions, but those were not responded. Are you aware of that? Well, it doesn't mean that there was no questions. There were questions, but that was not responded. Well, if I'm allowed, I'll continue to ask all the questions that I have in mind. Why didn't you ask at that time? Because I wasn't given the opportunity. You didn't ask me. Well, we really had basically no time for Dr. Shibuya's questions. The time was so limited. And we were basically, the time was over. Well, I don't want to continue arguing about this point here, but from my perspective, well, having created this abstract, I should have actually sent it to you for your final confirmation. I didn't do that. I'm sorry about that. But I really extracted some the contents from the main paper to create this abstract. So, well, there is bias in you choosing certain excerpts. The increase of the incidence of thyroid cancer. Well, that, yes, I agree. Yes, that's. But after that, well, Shibuya sensei did say that there is a possibility of overdiagnosis. That is true. That's why I wrote this. It was him, Professor Shibuya, who said that. Well, the abstract does not reflect my opinion whatsoever. I'd like to just add this point at this moment. In my understanding, screening effect is not an explanation of what is occurring. So therefore, could it be overdiagnosis or other factors? And one factor, obviously, is the effect of radiation. So in that sense, isn't there a necessity to consider about these factors? I believe that was the agreement that we reached at that time. And during this discussion, there were some doctors who were focusing on radiation. There are other doctors who were focusing more on overdiagnosis. I believe that was what has happened, and that's what Kasuga-san, you told me as well. And slightly in this abstract, Professor Tsuda feels that this abstract is leaning too much towards overdiagnosis. I think that is the discussion that just occurred now. Let me add one more point. Dr. Tsugane has been using the word overdiagnosis, which has been misinterpreted. He uses overscreening. He uses screening effect. He uses overdiagnosis. But when he says screening effect, it's not the same context or same meaning as what other people say. I understand what he means when he uses these terms, but there is certain difference, and there is a room for misinterpretation. So that has to be explained. If that is not explained, I think Dr. Suzuki would be upset as well, because according to Tsugane-san, his interpretation and his use of the word screening effect and overdiagnosis is the most accurate. Well, but that has to be explained. Dr. Suzuki has to actually, I believe, would feel that this abstract is insufficient because it doesn't explain that.
Ich erinnere mich ein bisschen an die Zeit nach Tschernobyl. Das hat mehrere Jahre gedauert.
Well, hearing about this discussion, it really reminds me of what happened right after Chernobyl. There were so many years when we had this kind of discussion.
In den Regionen um Tschernobyl durch den Unfall verursacht worden ist.
After the Chernobyl accident, regarding the increase of the incidence of thyroid cancer, it took so many years for the public to acknowledge that it is not the screening effect, it is not the overdiagnosis, that it is really the result of the radiation. This exact same discussions, exact same debate is going on right now as then. And those certain people said the same thing as today, which is that we are implanting fear among people, and that is why we are seeing all these incidents increase. Now that the accident has happened, and it seems that in the future, with another nuclear power plant accident, there will be exact same debate over and over again. Thyroid cancer, could it be because of the nuclear power accident? We are again debating the same point exactly as if the Chernobyl accident didn't occur at all in the past.
gestoppt werden und gut behandelt werden, sobald irgendwas auftritt.
大事なの
What is important is to really look after our children to make sure that there is no abnormality among children, to observe them and to make sure that children can lead a happy life. And that should be the purpose of our actions.
Der Region von Tschernobyl, der
で
Anstieg.
私たち
As far as I understand, it seems that in Fukushima there is a similar curve to what we have seen after Chernobyl in terms of the increase in the incidence of thyroid cancer. So just 1 or 2 years, there will no longer be a necessity to discuss this topic like this, which means that there perhaps it's quite meaningless currently at this point to talk about this now.
To intervene here because we have scheduled the thyroid discussion for after the break, and I think if the disagreement between Professor Suda and Dr. Kusuga is settled, we should move on to our next topic because we do need time to discuss this thyroid issue. I have some slides I would like to show from a recent paper which has been written by Professor Williams, who is really the European leading thyroid pathologist. And he's studied the Chernobyl data very, very closely, and he's also looked at the Fukushima data. So I think we should hear what he has to say, but I need to be connected my computer to be able to show a slide. But so I would suggest, if everybody agrees, that we move on to discuss the 100 millisievert issue. Is that all right with you? And the reason why I think this is important to discuss is because the present situation, as was outlined by Professor Suda, the authoritative position, both internationally with the IAEA and the UNSCEAR, and with the Japanese authorities, is in conflict with the evidence that we heard this morning from 4 speakers. So this has an impact on the next subject that we hope to discuss, which is the psychosocial effect, because it's unsettling to the public if the authorities are disagreeing about risk, something as important as risk, something for which every member of the population has the right to know the risk to which they are being exposed. And if there is a disagreement about whether it is a risk or not a risk amongst scientists and scientists who are advising governments and international authorities, which are also advised by scientists, is very important that this is resolved before it has an impact on public health. So I would like to ask Professor Hamoka to open up debate for us on this subject of the 100 millisievert claimed threshold. Is it true or not?
This is going to be my personal opinion. So 100 millisievert idea is wrong. But that's my proposal based on LSL detail analysis that I've done. But still looking at UNSCEAR reports and ICLP recommendations. So this has been also mentioned. So still people believe that this is a threshold we should trust. As Professor Tsuda got angry. Well, additionally, ICLP and UNSCEAR They said no threshold. ICLP and Scare said that there's no significance. So some people think that there's a threshold by Japanese people, by some of the Japanese people. And those Japanese people are majority of the opinions about this idea. And even those people who believe there's a threshold, whenever I point this out, they say that, isn't there anyone who believe in the 100 millisievert threshold? And it looks like I'm just a stupid. Or just people just laugh at me just when I said that. So even experts, self-claimed experts included, there's no one who said there's a threshold in Japan. But still, authority believes that. So in Fukushima, every 3 months, the report is issued to Fukushima. And also the media, most of the media believe in the threshold. So that's a very problematic and disastrous situation. Well, everyone thinks that it's wrong, but no one tried to change the mindset or rectify that mindset. So lack of statistical knowledge among some people, that leads to misunderstanding or the misinterpretation of the data. For example, not looking at all the data. So some just limit the sample to 120 millisievert, reducing the sample size due to the manipulation of the data. So some people believe that it's not that there is no impact. So we have to have better statistical literacy to interpret the data. This applies to almost all the Japanese people. There's a lacking or shortage of literacy in statistic data. So this is a long-term problem. You talk about the university entrance examination. We started to have the statistical issues. So that belongs to statistical, sort of mathematical B test. Well, this is not related to what we're talking about, but depending on the university, they have a different scope of the area for their entrance examination. A lot of universities doesn't cover statistics, and they don't teach statistics in universities. Even the textbooks deal with the statistics, but professors skip the teaching of statistics. So a lot of students don't have any lessons about statistics. So people don't have the understanding of what is significant, what is not. So that's not understood in the society in Japan. There's something we have to spend a long time to change the situation. In Okayama University, researchers said that having more statistical problems, issues in mathematics too. So they have evaluated whether that helped to improve the student understanding of the statistics by introducing the subject into their entrance examination. Additionally, you talk about the sample size, but as I said earlier in my presentation, for example, limiting to thyroid cancer, so we have a significant data. If we just focus on young people, again, we have a significant results. So that, there's no point of us talking about this in the social phenomena situation, targeting a specific age group for this particular type of cancer. We have a question in looking at particular age group and particular type of cancer. That's how we just make proposal based on this limitation or limiting the scope. If we look at the averages of all the people, if we look at a lifetime, even we look at the data in Hiroshima, it's we just look at a 70-year history from the point when the bomb was dropped. So of course, the problem is the lack of statistics, but also the people don't read the data carefully. Well, that has led to another problem of this mistake. Based on LAT model, less below 100, there's no significant results. So that the result is so insignificant, so we don't have to worry about the situation below 100 milli Siebelt. What do you think about this, Mr. Hamaoka? Well, of course, there's a risk. We have to say that there's a risk, and this is the amount of risk we have to be aware of. We have to make it clear for decision makers to use. That's the way we should use the data. So with the way we do now, below 100 Siebelt, well, simply put, there's no impact based on the data. There's no data to support that information, but the decisions are being made based on the groundless discussion or data. Well, there are no one who support from the government, so I'll just play, just to try to argue against what you're talking about. So the doctors in cancer centers, they just compare the risks with the smoking risks, for example. That's how to indicate the risk level of radiation by comparing with, for example, smoking. But in Fukushima, from the prefectural university hospital viewpoint, so decisions have been left up to the doctors in that institution. So, Mr. Konta, what do you think? Any comments from your viewpoint? I've been working in Fukushima, working as an internal doctor. IPPMW invited me to a meeting, and I talk about the situation in Fukushima at the conference. Some concerns, I'm worried about the situation, even I live in there. Professor Tane and I were on the committee, and I work on the thyroid screening. And when I was invited to a group of mothers, 20, and invited 20 children or so. In official manner, we conducted thyroid screening. But what I try to be careful about is that when we find something and they go to other prefecture to take action on that, that's not ideal, good for the data. So when there's something wrong with their findings, then they have to go to the Fukushima Prefectural Hospital to take a proper examination so that they can register themselves at the Fukushima's registry so that they can move on to the secondary screening for another cancer. And also from the Fukushima Prefecture, well, this is what happened the other day. There was a seminar for the radiation and also the cancer. So there's no trust on the doctors who are staying in Fukushima. So we have to the seminar is intended to help doctors to regain trust from the general public in Fukushima. And the goal for this is that, so as Dr. Hokuto said, that people in Fukushima are concerned and worried about that. We have to have better communication of the risks, and we have to respect what the general people want in Fukushima. In this situation, so local doctors will talk closely with the people and advice is quite effective to be given to the general public. And at different locations, we have to hold seminars for the radiation and also cancer relationship in Inashiro where I work. As a doctor working in that section, I was advised to have a lecture for the general public, and I joined the study session to learn more about how to explain the radiation and cancer to the general public. So there's no deformation, there's no carcinogen. So I'd like to ask Mr. Suda to take a look at the data. So I don't have 100% trust on the data itself given to me. So the prefecture government has a budget so that we can have the study session. And I'd like to be closer to the local residents who are concerned about the situation so that I can eliminate their concerns as much as I can. But people are very concerned about the food they take in. Particularly, they're concerned about the fish. So people say that they don't let children eat fish because they're so concerned. They're just going to a very extreme situation. So having such a bad balance of food will have a negative impact on the health. That's something we have to discuss as a different topic. And also in Fukushima, what can we do to survive in Fukushima? Not just some food that might be contaminated with the radiation, but the genetically modified food or the pesticide problems we have, and also additives problems in food. So I would like to cover more of the topics. The biggest concern is that when I see the patients coming to the hospital, high blood pressure, diabetes, and then atherosclerosis. So those diseases are increasing. Even I see people at my clinic, people tend to get cold more easily, more frequently. So we have to offer the right information to be closer to local people. We think this is important, but with the information from the prefectural government, I don't know how much I can trust of the information that I have been given by the prefecture.
Sorry for speaking very fast.
This is exactly the psychosocial problem. I mean, diet is one of the pathways through which health is damaged because people choose not to eat certain foodstuffs because they don't trust the advice they are getting. So personally, I think this issue of the 100 millisievert doesn't come down only to an issue of the lack of statistical understanding by the public or even by scientists. I mean, I understand it is the policy of several professional societies in Japan, and it is the UNSCEAR, for example, is not clear on the issue of 100 millisievert. They don't say is the threshold, they just say that there's no evidence for anything below that. And now that, as we heard this morning, that's not true. I suppose it may have been when they last said it. But so this is a bigger problem, and I think I don't know what the audience thinks about this, but one way of dealing with this would be, for example, to tackle the representatives of Japan on UNSCEAR and the ICRP and ask them to justify their position for supporting or not rejecting the idea of a threshold. Is that a possible strategy to try and get this issue into more open discussion? Would anybody like to comment?
ICRP の問題がある。
The issue of ICRP, yes, it's true. However, within Japan, as a domestic issue, regardless of the recommendation of ICRP, Japan does not follow it at all. Actually, the explanation is totally opposite to what ICRP recommends. And that's why there's no conformity of Japan. That is a problem. As to the UNSCEAR report, it says identifiable and discernible damage may not occur. That is a wording of UNSCEAR report. And Dr. Weberstock criticized it, and therefore, how do you interpret, how do you take this wording or issue?
I think I said in my criticism of UNSCEAR and their report on Fukushima that they were not behaving like a scientific organization. They claim the S in UNSCEAR means science, United Nations Scientific Committee. So they were not behaving like scientists because they took a position which was ambiguous. You could interpret it if you wanted to as they supported a threshold. You could interpret it that they were not supporting a threshold. So they have not made their position clear. But the individual members of the committee can be approached and asked what their position is and how they justify it. And if they don't say clearly that they believe that there is no threshold, then they should be able to justify that with a scientific argument as to why there is a threshold. At the moment, the scientific community that's interested is being asked to prove that there isn't a threshold. We're not asking them to prove that there is, or we might ask them, but they are not responding. Yes, Gaston.
I have a question for my own information. Interestingly, you talk about political manipulation of the information on the 100 millisievert threshold. And in the beginning of this discussion, you talked about a scientific disagreement. So, of course, we all agree that political manipulation is unacceptable, but scientific disagreements are simply part of our society. So, my question is then, how much is the general public, and then I'm not only talking about citizens' demand in the street, but also civil society, so to speak, the NGOs, how much is the public aware of this scientific disagreement?
Probably not aware of it if what Professor Suda said this morning is true. They're probably not aware of it. They're probably aware or being led to believe that the scientific position is that there is a threshold. And it's not being effectively challenged in spite of Professor Suda's efforts to do so. And one wonders why he is the only person seemingly wanting to do that, because the evidence is really so clear, as we heard this morning. The other side, as it were, has got to come up with something to say that all that epidemiological evidence is in some way flawed. And while it is possible, as Professor Hamoka pointed out, that you could draw different models through the data for the Japanese bomb survivors, it's not possible to draw those models with Professor Matthews' data. So there's a clear scientific position on one side, but there's a total lack of clarity on the side that is winning the argument at the moment.
So my next question would then be to Professor Tsuda, but also, of course, other people from Japan can respond to that. Do I understand it well that up till now there haven't been any information campaigns on this alternative vision we all support? In Fukushima itself, for instance, have there been information campaigns to counter the official position of the government?
May I? I am writing my question to Dr. Tsuda, but then I believe this question is related to what we discussed right now. Therefore, I'd like to touch upon that. Immediately after 3/11, March and April situation, Dr. Tsuda mentioned from April to May in many academic societies in Japan claimed the safety of 100 millisievert by using their websites. However, a little bit before that, I remember what happened in March. Actually, in Japan, anti-nuclear power generation professor Dr. Koide, there are two Koides. One of them is well-known Hiroaki Koide. The other Koide is Goro Koide, who is the ex-director of NHK to be the expert critics. And then this person from April to May, the opinions of ICRP says that the 100 millisievert is safe. He said it in the lecture. And I asked him, where could we find it? And he said, if I go to the recommendation in 2007 of ICRP, you can find this sentence. However, in the following 2 years, this Koide have received my question to identify where this recommendation was written down. However, unfortunately, this person has passed away when he was still NHK director. That was to the anti-seismic design of Hamaoka NPP. He is the only one person making a kind of criticism among many NHK-related people. He's a really genuine person. And in March 2011, he says that 100 millisievert is safe, according to the ICRP. However, he just parrot what the other person said. However, because of the impact as one of the journalists, he presented himself in front of us in the lecture. Another NHK person, Mr. Torigoe, he insists that 100 milligrams is safe. And then he communicated this ungroundless information every morning. However, after that, in April, the situation changed a little bit. However, in March, all of the journalists insist that 100 millisievert is safe. So they lay the foundation and they inculcate this wrong idea into the general public mindset. So I recall and I have to remind you that the mechanism existed in March.
それに対する批判の考えは崎山先生は
I believe the criticism against such argument has been repeated many times by Dr. Sakiyama. What do you think? Microphone, please. Well, this is completely apart from science. This issue is completely something else from science. The cause of cancer, well, the very initial trigger, as everyone knows, is the DNA damage, the radiation energy, and the molecular combination energy of our body. Comparing the gap between the two, just one irradiation could harm and damage some DNA within our body, and that is something that anyone can understand. And in 1.3 millisievert is really the minimum level from which there are such damage, which is already proven through experiment in 2003. So from theoretical point of view and logically, even at 1 millisievert, there could be a trigger for cancer. That is something that we could state already. The problem is epidemiological studies. In the ASCARE report and in the epidemiological study of Switzerland. Well, the Swiss report was just announced in February this year. And it states that with even 1 millisievert, there is an 4% increase in the brain tumor and leukemia. And considering these results, it seems that up until now, the mechanism of the cause of cancer and the epidemiological results that we have seen so far, I think epidemiological study results, especially with large cohort, can fill the gap that has so far existed. So 100 millisievert threshold discussion is no longer a matter of science. I think it is within the sphere of science, society. It's within the sphere of society. So why is truth hidden? Why are scientific truths and evidences hidden? And why are we believing so much in the safety myth? We need to understand why so that we can prevent such situation. I think we need to switch the direction of our discourse and discussion. I would like to also state an opinion. My name is Kawane from the Citizens Organization Thinking About Internal Radiation. When we talk about 100 millisievert, well, as Professor Tsuda's presentation mentioned briefly, is this annual per annum or is this a cumulative dose? That perspective is completely missing in general. In Belarus, in Ukraine, we should always talk about the lifetime cumulative dose. If you get the cumulative 70 millisievert, there is an impact to health. So if we were to live 70 years, then it would be 1 millisievert per year. That was the basis of the discussion. But in Japan, however, are we talking about the lifetime? Are we talking about 1 year? It is all mixed up. From 5th of September, all the citizens and residents of Narahamachi should return there. But that threshold is 20 millisievert in Naraha. That is 100 millisievert only in 5 years of residency there. They are already talking about 100 millisievert threshold. That's 5 years of living in Naraha. I think we should talk about that. When we talk about millisievert, I think that is a false discussion because we cannot to have an accurate measurement of the total dosage, including external and internal radiation. And if you were faced this way, this way, this way, and this way, the radiation impact is different. Can we really talk about only air dose? The government only talks about air dose, and this is falsifying the current situation. So in that sense, we need to talk at least on the basis of lifetime cumulative dose. Otherwise, there will be no basis of discussion here. I think that should be the first step as we think about this issue. And as Professor Kasuga said, well, what happened to Chernobyl and our experience of Chernobyl? How can you come up with such an outcome of the study group? Are you really making fun and mocking the scientists who have been studying Chernobyl up until now?
Clarification, because my understanding is that it's 100 millisievert threshold, and if you exceeded 100 millisievert, you would start to incur risk. So if the lifetime dose was over 100 millisievert, there would be risk would be incurred after you had achieved 100 millisievert. So that, I think, is the position that we're dealing with. But that position is wrong. It's even more wrong if you're saying 100 millisievert per year is safe, which I have heard said. But I think, Cecile, you have a... Yes.
Well, maybe I'm repeating myself slightly from what I had said yesterday. I fully agree that this is not a discussion and an issue in epidemiology, I personally believe. Well, unfortunately, I was not able to attend this morning's session, but Dr. Beverstap, you might have mentioned INWORKS results of
So,
Okay, but InWorks result has been announced in Japan, and I read it in a Japanese newspaper. So let me introduce this June. There was an announcement and release of the result of a study called InWorks, which is a large cohort study of 300,000 nuclear power plant workers were subject to a long-term observation of their health effect. And they studied the incidence of leukemia and death caused by leukemia, and also the impact of low-dose radiation. The causality between these two are suggested in the InWorks study. Even today, 100 millisievert threshold discussion. Well, by the way, I am not an epidemiologist at all, not a specialist here, but I think there's no point in discussing about this at this point anymore when all these results are out. In any case, from the very beginning, the Japanese government has been decided and fixated on their stance of pro-nuclear promotion. And in that sense, they wanted to quickly make people forget about the impact of the nuclear power plant accident. So in that sense, because they needed to open and release these restricted zones, they needed to come up with some certain threshold. I personally interpret like this what has been happening in Japan and what the government has been doing. Well, I want to avoid talking about something that is too complex. That would be misleading. I think we sometimes need to simplify the situation. That's why I simplify what has happened in this way. Well, the evacuation zones will all be released and in the future. But at the same time, the reconstruction is not taking place so smoothly. It is so far away from urban areas in Fukushima. I don't want to be rude to people from Fukushima, but I say this because it's exactly the same situation in France. The government's not willing to spend so much budget in a place like that is a rural area. The government has already chosen as their priority the urban areas. And when you think about the next generation cities, we were talking about smart cities where there will be exponential need for energy in the future. So we are really moving towards the opposite direction of needing and more energy. And because of that, and through this, a massive amount of energy would be required in the future. And in that sense, the nuclear power plant, the need for nuclear power plant would be demonstrated, I believe. That is really a high-level thinking I have regarding this matter.
This is not just an epidemiological issue. If I look at this issue from the only epidemiological viewpoint, then we may just miss the point. If I talk about the media issue, they don't probably like me, but with the Koide-san and Torigoye-san listening to that, I was a bit surprised actually. Well, this is my personal advertisement of my book. In August last year, in Asahi newspaper Journalism, that's a magazine, journalists should check the scientific founding of the evidence. That's what I said in my article. I was referring to 100 millisievert issue. But the Japanese journalists, as Mr. Koide said, think that ICRC says it's safe. I don't know how many people they talked to. They didn't clarify the number of people they talked to, and they didn't disclose the source of information as to who told that. Whether that's what ICRP said, or that's what ICRP has written, or if it's written by the ICRP, then in which sentence, where exactly the information is written. They didn't confirm the exact location of the information. They don't check the location. Well, this is not just limited to this issue, or not just with the journalists, but Japanese authorities, they don't check the information source. So this means that for the Japanese public health policy, or they think everyone says this and that, or people around me said this. So everything is decided based on those low-level conversation. They don't rely on the scientific evidence. And journalists said everyone says this and that. That's how they write an article. And when asked where did you find the information for your article, and exactly where, in which sentence, and which number you have confirmed, they don't check those details. Well, this can be done simply and easily, but they don't do that. Well, that's a customary thing for them to do. Well, that's the situation where the Japanese journalists are. Well, there could be a lot of objections from that comment. My name is Aihara, journalist. Well, it depends on how we see data or the numbers. For STS, social technology, that's one of the well, there's a chance that the numbers has a political intention. So that's a typical idea in this disciplinary. When we think about the medical policy, we often use numbers to make a decision for the medical policy. In the welfare, people aged up to 18 are regarded as children, but in the civil code, 20 years is the age by which people become an adult. So we use the age or number to make a distinction. But in our society where we live, by age or by income level or by any kind of number, in some cases we can't really make a decision based on simple numbers. But the problem here is that in policy making, using number, it does sound like a scientifically proven, and there's a consensus by the society, and it looks like a Japanese public accept the consensus. That's a fictitious agreement. And when the media plays a major role, or the academic circle has a significant role, or there's no peer review by the professionals, one theory sounds wonderful. So, well, this is a very typical situation. As Dr. Konta said, well, I thought that's a typical when I listen to your presentation. When you go to other prefecture, there might be something wrong that may happen. So that's why Fukushima people have to register themselves at the prefecture. Well, so if let me use some dialect from Fukushima. Well, I don't really know what the specialists say, whether it's related to radiation or not. It's not a big issue among Fukushima local people. But the fact that this number of children suffer from thyroid cancer, whether it's an over diagnosis, that doesn't really matter. The question is, are these children being taken care of properly? So after they're taken care of, then we can have a discussion on whether it's an over diagnosis or not. But the people in Fukushima are not really concerned about that. So 100 millisievert discussion, that is the basis for the future policy making. But the actual treatment given to the local people, the health support isn't good enough in Fukushima. That's the situation we have to look at. So what the elite people say isn't really needed by the local people. So we just focus too much on the things that is not that important to local people. So the government or the authority will try to make up with something fictitious to make people believe this is true. And well, that's, I think, what's happening at the moment. And people talk about screening effect or overdiagnosis, over medical care. Overdiagnosis was mentioned in one of those presentations. Over examination, over medical treatment or screening effect. There are a lot of words and numbers are being used in the discussion. So I feel uncomfortable with seeing those situations happening in Fukushima that's not really meeting the requirements of the local people. Well, let me say, well, it's too late if I wait. That's very important. She made a big mistake in her comments. Why are you trying to stop me from making correction? So I had a son. Are you saying you don't trust numbers? So what else can you trust then, other than numbers? Well, I'm not saying we shouldn't trust numbers. Well, numbers may have political intention. That's something I have to pay attention to, having a better literacy of understanding of numbers. So people in STS community, so then what do they use as a basis to make a decision in STS? They don't talk about anything specific. But on the other hand, they don't have a discussion among themselves. They just say whatever they want to say, that's all. Well, as an extension of this discussion, to come up with a social agreement, we have to have a forum or time to have a discussion among different people. Well, that's what I'm thinking. So I'm not saying we shouldn't have that discussion and we shouldn't distrust numbers. Well, that's not what I'm saying. Well, may I? Well, I think you misunderstood me. Peer review, Professor Mashi wrote a paper, and the way how he came up with a number is that there's a check of the conflict of interest to become a peer reviewer. So as you said, you talk about the mechanism. Well, that's a very cumbersome mechanism. We have to go through such cumbersome process. That's how we have to have papers reviewed by peer review. Well, we have done this already. Well, in some cases, there is some oversight even after such a rigorous process or check. So I'll give an example. In WHO report, a representative of Japan indicated in conflict of interest and just secretly attended the WHO meeting without indicating COI. Well, there's a disclosure of such thing, but the media is not aware of such fact. Haven't read the WHO report. Additionally, Dr. Kasuga have had a discussion on safety and security. So this doctor took a leadership in the meeting and with the government meetings or Japanese Society Association. They don't have any simple procedure of checking the conflict of interest. So that's been missed out in this process. So such a basic process, has been done in a scientist society where journalists is not aware of such simple process that the researchers and scientists have gone through. So the presenting document is quite rigorous process. I was talking about 100 millisievert. So that's for the 100 millisievert. That's what I was talking about. Well, the number 100 millisievert specialist said that this has been proven by the specialist. But we are on the same ground. But you're saying that we should doubt the numbers. So then what else can we trust other than numbers? That's the question. Well, if the number is driven, so number is driving the policy, that's an issue. So there's a budget, and there's an interest of some people. That's how the number are being, well, that's wrong as well. Of course, well, listen. This is the number 2. This is already a concept. Showing the number means showing a concept. Scientific paper needs to present numbers, and we have to apply the numbers to the actual application in the society. Well, there are a lot of factors to make a decision. Of course, we have to go through different factors. So you're just saying that numbers cannot be relied upon. I'm not denying the importance of numbers. When numbers are being used to come up with a political policy, well, in that sense, as I said earlier, medias just look at the numbers only. So below 100 millisievert, there's no chance of getting cancer. When I ask for the specific number they cited, they have no way to locate.
I know there are many people who want to speak up, but before that, at the very beginning, Dr. Mesken said this, that is on the side of citizens, on the side of survivors of 311, what are the counteractions raised by themselves? Think of the 100 millisievert. It's really abstract, ambiguous number, and this is not related to the crux of the issue. However, in order to give some effect, many people tend to use 100 millisievert. On the other hand, there is another threshold, 20 millisievert. This was used for the opening of a school, and whether or not we can use the 20 millisievert to make a decision whether or not we can allow people back to their hometowns. And for this issue, there is a lawsuit going on in the city of Minami Soma. So this is really related to the crux of the argument. In such a case, I assume Dr. Musso or Dr. Matthews, what you call scientific data, must be referred very heavily. In addition to that, LSS criticism of Dr. Hamaoka may be referred by the defense camp. So I'd like to ask for your opinions. So first of all, can I ask you, Dr. Kageura, because you have been involved with this issue from the very beginning. You're not ready? Then how about Dr. Matthews? In your view, in your research, in the political context, if your scientific papers may be referred as the lawsuit in Japan, what do you think about that possibility? Your papers may be referred as a court.
I guess that is a possibility. Let me just say what I think about the millisievert level. I do believe there is a risk certainly below 100 millisievert and below 20 millisievert, and the risk is much greater for children when exposure at an early age. Of course, the implications of that
are twofold. In the medical area, it might lead to a suit for medical negligence, and the problem is not just for Japan, it's an international problem. In the USA, the radiologists, some of them are rejecting the importance of exposures. They don't want to explain, they don't want to get informed consent from children and their parents for a CT scan. They say they don't want to do that because they think the evidence isn't proven. I guess if you're a cynic, you would say they're doing it because they don't want to reduce their income from the number of scans that are done, because if they had to explain to children and their parents what is happening, many of the parents would say, well, we don't want to undergo that risk because our child only had a small bump on the head, and all they really need is to be watched for 2 or 3 hours to make sure that they've got over their concussion. And so that area is very complex. But of course the other complex area for the Japanese government is managing the risk if they acknowledge it exists. And that is a very political area, because the costs of trying to clean up down to a very low level of exposure are very high. So my bottom line is the risk goes down to a very low dose. The cumulative dose is obviously important, but the more you accumulate as a child, the bigger the risk. And we don't need to worry so much about the exact number, which I think is what I heard Ihara saying, but getting the debate going with the community, with parents, with radiologists and government is important, and trying to get the debate going without it being confrontationist, I think, is very important. Gaston spoke about that yesterday, and so how you do that is the challenge. And I think the first challenge is for the group of people who've been interested enough to come today to not worry about the small details, but to think about the big picture. I think that's very important.
I would like just to put a bit of perspective into this. Yes, in a moment. If a person took a newborn girl to live at a place where the dose rate was 20 millisieverts per year, by the time that girl reached the age of 10, she would have increased her lifetime cancer risk by 10%. That is roughly from 30%, which it is for people not exposed to radiation, to 40%. Now, that's a serious risk. And it seems that we have a very big consensus here that that risk is real. So I think the question for this meeting is, what in practical terms can one do to change this opinion? One possibility, I don't know whether it works in Japan, but in some countries there's a process called judicial review, where citizens have the right to go to law and seek a resolution of this. In that case, it would involve a debate with the evidence in a court. That's not an ideal place to have such a debate. But if it can't take place in the scientific, normal scientific context, that's maybe where it has to take place. So does anybody have any further? So.
ちょっと先に行く前に
Before moving on, I'd like to confirm the facts. They argue is 100 millisievert, and this is total dose. However, 20 millisievert annual dose. This is a political number. I believe everyone has known it. However, in overseas countries, and if you don't know how these two sets of numbers are developed, it's very important. Because depending on the background, what kind of actions we can take and what kind of discourse we have to take, these important points may be influenced. That's why I share this fact and background of 20 and 100. I'm Yoshida, pediatrician. In Dr. Matthew's paper, I'd like to add some information, sorry for being arrogant, but I noticed while I was reading your paper, after the paper, there are many opinions, including refute. And those who refute your papers are government people or establishment, such as RERF, or the United States. ICRP, the United version, Dr. Voice. So RERF and Dr. Voice fiercely oppose your opinions. And then reverse causal relationships are advocated by these people, saying that your paper is wrong. However, if anyone read the paper, you explain and articulate reverse causal relationships. It's clear in your papers. However, they ignore and just saying that because you invoke the reverse causal relationships, that's why it's not good. In the papers related to CTs, practitioners can make the opposition. However, experts and the government establishment related to the radiation protection makes many criticism and opposing opinions on the website. And I wonder why. I believe your paper is so shocking that they have to ignore your paper. That is my impression. Sorry for the 2 cents of mine.
影浦さんどうぞ。
影浦さん please.
It's almost clear among everybody attending here, but let me go back to the question by Professor Meskins and pick up the word convince as a point of departure for sort of wrapping up. And listening to the discussion so far, I think it is almost clear that when you're talking about convincing individual, properly learned scientist or learned person, the scientific evidence that we have had so far provide the sufficient basis to show that there's no threshold or the LNT is, no, there's no such thing as 100 millisievert threshold, something like that. So, but if we turn our eyes to convince society at large, then the point raised by Sakiyama-san suddenly comes into play that we are not really in a position to be able to convince the many people who are not that much concerned with this issue. So that's one thing. And the unfortunate fact is that I'm sorry to say this, but what Aihara-san postulated, I don't mean that what Aihara-san meant or tried to mean, contains an element which sort of ambiguate the point. Because when you're talking about the numbers, right? As Tsuda Sensei pointed out, that there are scientists with integrity who have been meticulously manipulating the experiments and everything like that, right? While on the other hand, there are people who portray themselves as scientists, or probably scientists anyway, who do not really care much attention to the evidence that contradicts what they want to say, right? And that sort of manipulation is within the realm of science as such. Of course, indirectly, the science at large should be influenced by the social surroundings, but that is slightly or qualitatively different from the manipulation of numbers when it is applied to society. And the irritation that Tsuda said, I'm sorry to use this word, irritation that Tsuda Sensei showed in reply to what Aihara-san said is something that I think widely shared by serious scientists who tries to be faithful and who carry on experiments meticulously and abide by the criteria for scientific integrity. Because to keep scientific investigation straight is something different from to keep the application straight to the social realm, right? And I'm afraid what Aihara said sort of mixed up these two aspects. So I think from here, from the discussion today, I think on the scientific arena, it is clear that there is a convincing evidence to contradict. There's such things as threshold at 100 millisievert or 20 millisievert per year or whatever. While on the other hand, there are problems in convincing people in a wider area. Yeah, that's it. Thank you.
If I may follow up on that, I didn't use the word convincing. It was about providing information about different visions on that. And I think it's important because if citizens of Fukushima, if we see reasons why a citizen in Fukushima would not want or need to believe a government expert, why would that citizen believe an expert with an alternative view? It's an alternative view. People will not necessarily get confused by conflicting evidences. It is the first thing they need to know is that there is an informed alternative opinion on these things. So then my question would be again, why hasn't there been any information campaign by NGOs, whatever? Maybe I'm very naive in my question, but why haven't there been any information campaigns in the Fukushima region on this that would debunk, from their point of view, the government position? And then second remark, I think we are missing one dimension of the discussion here. I think we all agree that, as was also said before, the scientific debate is somewhat settled. I mean, we have evidences of specific causalities. But we also know at the same time that if a citizen in Fukushima asks you, what does this imply for me and for my children, we cannot answer. We cannot tell that person whether he or she would have a negative adverse effect or that the children will suffer. We cannot say that. It's statistics. But I think, the dimension we are missing here is a dimension of democracy and justice. We now talk about the problematic doses of below 100, up to 20, and even lower. But it doesn't matter anymore then whether it's 5 or 10 or 100. What matters is that nobody has chosen for that doses. I mean, we still live in a society where people may take risks on a voluntary basis. whether it is 1 millisievert or 5 or whatever in Fukushima, those people have never chosen for that radiation. It has been imposed on them twice. When nuclear was introduced without any form of public participation in the beginning, and now with the accident. And I think if we talk about doses, then we always have to really add this message about this democracy principle.
It's not that Japanese people are not doing. A lot of NGOs and other civil organizations are voicing this fact, but it is not reaching certain people because we don't have, unfortunately, the political power. And one way to do so is the lawsuits, and I believe that lawsuits is a one way to break through. And this symposium, in a way, is also an example of perhaps an opportunity to change this political situation, to create a forum where we can voice different opinions. That is one of the objective of this symposium, as I understand. Please. There was a discussion about why I'm insisting so much on 100 millisievert. Well, let me answer. Well, in Fukushima Prefecture, the Fukushima Prefectural Authority is saying that there is no cancer incidence because of the accident. Even if there were increase in the incidence, they don't know. That is what they state, and that is what the Japanese government is also stating. But this is supported by two preconditions. First precondition is that there is no cancer due to radiation under 100 millisievert, and even if there were increase, it is undetectable. That is one precondition. And second precondition is the following. The second precondition is that the actual radiation dosage is way lower than 100 millisievert. So then we are only talking about external radiation. We are only talking about external radiation. Because of these two preconditions, the government's and authority statement are supported. And furthermore, the first precondition about 100 millisievert threshold is already denied and objected by numerous scientific evidences. So no expert is talking about it anymore. About the second precondition, about the actual dosage in Fukushima being much lower than 100 millisievert, well, when we look at the radiation in relation to the thyroid cancer, it seems like this is really not the case. So with quite high certainty, we can say that the dosage is quite high, and as long as, at least in relation to thyroid cancer. So these two preconditions. The first precondition does not hold anymore, and actually the second one as well does not stand. And we could view, I think it's most adequate to view that both preconditions do not hold anymore.
So there's no cancer in Fukushima. Well, I don't think that's true anymore, as we've seen numerous cases of thyroid cancers in Fukushima. Apart from those conditions, well, directly we can deny those statements. But some people still don't believe what I'm saying. But sooner or later, in 1 or 2 years from now on, everyone will have the same idea that I just explained just now. Well, that will be coming in a moment. Like I said, even now we have numerous cases of thyroid after the relapse, after the some time of time, then we will have more thyroid cancer coming in. So there will be a substantial increase in distrust on the authorities. Even now, there's a certain level of distrust on the authorities, and people will be concerned about who can trust, and there's no government they can trust anymore. The situation will get even worse. Well, that's what I'm concerned about happening going forward. Well, let me continue. I'm going to finish in a moment, so don't stop me. Well, it's not an issue between Fukushima and the central government. But if that has led to other distrust of other prefectures other than Fukushima, as for Chernobyl issues, there is a side effect of this thyroid cancer coming from the nuclear incident in Chernobyl. Well, question to Professor Musso. So in your research, so Matthew, so you talk, are you covering the research on fish and shellfish on top of birds and insects? In Fukushima, a lot of people think that the fish and shellfish in Fukushima are not edible anymore. Have you done any research on fish and shellfish? Have you covered this area as well? And as we are just discussing at the moment, so in your research, for example, or either IAEA or ASTIA, they have evaluated the risks in that way. Have you discovered anything that changed the statements made by IAEA or ANSCAR? So what do you think?
Well, thank you. Yeah, so before I start, I think I just wanted to make a comment about the 100 millisieverts since we're we're on that topic, and I think it's very interesting that we would settle upon this number, this arbitrary number, 100. Isn't it? It's a magical number, I guess, and we've just come to 100 by chance. That's the magic number. No, I think the discussion, what we're avoiding, or what is being avoided, is the discussion of acceptable risks. What are acceptable risks, and that's being avoided completely, and being hidden behind this 100 millisievert arbitrary limit. With respect to the shellfish, I'm not very familiar with anything other than a few measurements of a few fish here and there with respect to strontium and cesium levels. The question from my perspective as a biologist has been, what is it doing to the animals? Is it having an effect on the biology of the animals in the region? And it's really a largely a big unknown in terms of consequences to genetics, genetic damage, to the fertility of the animals, population sizes. And that would be the starting point for me. The biological endpoints of the contamination have really not been investigated in any way.
Hi,
My name is Alex from Michigan University. So the discussion has been very interesting. I learned a lot from this discussion. I have several questions to ask.
And the people I'm asking to have been speaking in English, so I'll ask the questions in English. Professor Musso, I would like to ask you about how you see extrapolation from information that biologists gather about animals and animal models, as that being applicable, or how that can be translated into effects or, I guess, conclusions for impacts for humans and human bodies. And my other question goes to, I do not know the name. Sorry, what is your name?
Me?
Yes.
Gaston.
Gaston?
Baskins.
Baskins. Mr. Baskins, your comments on democracy and justice, and what matters is that nobody has chosen these doses. About that question, I was wondering at what point in time we're discussing, because currently when decontamination work is being conducted, people are choosing to participate in that kind of economy and the payments that are being done. So would people who voluntarily chose to take part in decontamination work how might you think about their choice in the matter? Thank you very much.
Should I start? Yeah, give Gaston a little time to think there, but it won't take long, I'm sure. Most medical research that we use to cure disease is based on animal models, cell lines, plants even, bacteria. So of course the use of animal models for the examination of these kinds of questions is commonplace. This is what we do. We are just animals. Our basic biological machinery is the same as every other animal on the planet. We all share the same genetic code, everything on the planet. So there's absolutely no reason to think that we're any different in terms of the biological outcomes of exposure to radioactive contaminants. Now there may be differences in the slope and the intercept of the relationship, as it were, but the actual functional responses are likely to be very similar. So yes, I think that everything that we're seeing with animals and plants has relevance to humans, should they experience the same kinds of doses, I suppose. The question all really boils down to the time frame of response and whether the risks associated with that exposure are great or not.
Thank you for that question. Maybe from a general point of view, the need for public participation in political decision-making, such as on nuclear energy, is not, if I make a plea for that, then it's not because I'm some kind of leftist intellectual. It is inscribed in the law of most Western countries. In Europe, for instance, it is inspired on the Aarhus Convention, the Convention on the right to information, the right to participation, and the right to justice for citizens. The most important article in that convention, also the way it has been translated into European law and national law, I don't know what the situation in Japan, but the most important article says that the public should be involved as early and effective as possible in decision-making on environmental and health matters. Of course, the problem with that article is that it is open to interpretation. What is early and what is effective? You can translate it, and many philosophers, including myself, do it, translate it as some kind of making a plea for new forms of democracy, public participation. Now, this is in the law today. In most countries, well, actually in all countries that have nuclear power today, that article didn't apply. In most countries, nuclear was simply introduced by the politicians that supported the idea back in time, in the 50s and the 60s. So we could say, from the perspective of how we see democracy today, all nuclear power has been introduced in an undemocratic way, because there was no article at that moment that could give the public the possibility to participate. So in that sense, this is why, because you were referring to what point in time? Well, this is the point in time. So it has been imposed on them, you could say, and the accident for people, they feel it as a double frustration. I will also speak about that tomorrow in my presentation. First, it's this nuclear power thing, and then of course it's the accident. And if today people volunteer to really participate in the cleanup, that does not contradict with my statement on democracy. On the contrary, we know that people can understand risks, and that they can, if they feel that they can make it their problem. We also see that in citing cases for radioactive waste, they are not necessarily, by definition, against the whole activity. That's the point.
we spoke a little about this yesterday time. まずリスクに
First of all, risk. At this moment of time, major issues are those who take risks, don't receive the history of risks. And now we can talk about the risks. We want to talk about risks. However, in order to communicate the risks, we have to use some kind of communication channels. Through these communication channels, the citizens' opinions can be brainwashed, led to the favorable way for the government. For example, there's workshops for elementary school children. We are led to go in a certain direction, and the so-called communication. However, under this situation, how we can get the real engagement of citizens? And I believe this is a problem. For example, for you, Gaston, the real democracy should be practiced. If everyone can take part in decision making, that is the real world. I agree with it. However, the situation allows it or not. Think about it. As far as the nuclear power plant issue concerned, it's too expensive, and the government want to brainwash citizens by using whatever they can do. From the elementary school children to the university students, they inculcate preferable ideas under the name of education. Therefore, it may be extremely hard to solicit voluntary participation from the citizens' side.
Referring specifically to the situation in Japan, because the way you describe it, it's very pessimist, and I would dare to say that maybe in Europe it's a little bit better in that sense.
For example, in France, as you know, we have some groups organized for the participation of people. The name of this group is CLI, C-L-I. And at the beginning, it was organized in the sense of you said
Let me speak in the Japanese. In order to listen to the citizens' voices, that is the main objective for the establishment of CLI. Do you know the official title of CLI? CLI is just an abbreviation. Do you know this? It's a kind of local committee. Thank you very much, Iwata-san. That is the official title of the CLI. At any rate, the CLI is a good organization to garner the participation of citizens, and then democracy can be practiced as we claim the nation of freedom and democracy. Anyway, if you look into the actual situation, it's far cry from the ideal situation. A leader and operators and owners of the NPP communicate what they want to communicate to citizens. And then they prepare the environment where public can accept the risk. So they cultivate the mindset of the public to accept the risk. Before that, we have to think about whether or not we can take this risk. As the ability of a human being, we can understand the risk. And some people said that we accept the risks if it's for the sake of the advancement of a human being and a society. However, sometimes risk-benefit loses its balance. Sometimes risks are by far bigger than the benefit. That's why I have to raise a question on this.
To close this session down, I would say Iwata-san, 30 seconds, Suda-san, 30 seconds. Gaston, 30 seconds. In that order, please. And 30 seconds, please.
And a follow-up. As Cecile-san mentioned, when I was in Fukushima and I now go to and from Fukushima and I look into what kind of communication made, I have looked into that and I have known it, and that's why I share the sense of risks. Based on that, as Dr. Meskins, someone calls this just ideal. However, and we have to make a proposal of this kind of new framework, and we have to change the situation. We cannot accept business as usual. We have to be out of the box. The government is really paternalistic, and citizens are too obedient to the government. And that there has been a long history of that. However, we have to break the vicious cycle. Dr. Shimano was also brainwashed, inculcated by the government. Just for your information, Dr. Shimano don't agree about me, but one thing I have to say is that the Chernobyl accident increases only the thyroid cancer in your wording. It sounds like that. However, it's wrong. It's not the case. And there are quite a rich body of evidence proving that. Then the second point is that below 20 millisievert, cancer can happen. As if Dr. Matthews or a handful of scientists prove it. However, there are many papers proving that the below 100 millisievert can cause cancers. In addition to Dr. Matthews, there are many papers talking about that, even at 20 millisievert. For example, Dr. Inge in Germany summarizes it in the table. And the problem is that that paper is not shared, and there's no effort to share it. And then the third point is that based on the Chernobyl alone, can we say that from the exposure longitudinally, chronologically, data is shown, and this is only available for Chernobyl accident, and the sample size is really huge. And therefore, there is no issue of sample size. Effect size is very effective, and number is big enough.
One pessimist answer and one optimist answer. The pessimist answer: the problem with new forms of democracy is that they should be introduced by those people who like to operate in the old forms of democracy. So the positive answer is that if you look back the last 50 years, lots of things have happened. I mean, 50 years ago, there was total technocracy. Now civil society is standing up, is much more active than before. So there are possibilities, also in education and also in resistance towards these powers.
Whether or not we can reconcile different opinions and mindsets, this is the issue. In my presentation in the afternoon, I review myself, and there is a huge chagrin to myself because this subsidized study itself was conducted by Dr. Tsuda, Dr. Kanaya, and they have conducted epidemiological studies with a bit different opinions. However, these different opinions were discussed meticulously in an appropriate ground. That's what I want to share. And that's why I was asked to share this report in today's meeting. However, because of what I focus in the broad discussion, I now realize that how I can invite unnecessary criticism. This is my learning. However, as to the interpretation of thyroid cancer, the direction of interpretation may be different, as it's elucidated in our discussion. I don't ignore the Chernobyl accident. I don't look down or play down the result of Chernobyl. Rather, we should not have any preoccupation to have future discussions. We have to emerge from stereotype. I know I have lost your trust and I can not be here next year onward. I review myself. However, please understand, please try not to pick up only one topic to criticize, and I believe this holds true to anything we want to see.
Okay, thank you. We must close the session now. I'm supposed to sum it up, but I'm going to do that at the beginning of the next session so that we can take a break now. I don't know, do we want to take just 20 minutes or do we take a half an hour? So we come back at 5:10. Thank you.